Hello dear patients. Today we are going to talk about the case of skin reddening on penis after treatment by liquid nitrogen. A patient from neighboring countries came to our clinic. Earlier he came to dermatovenerologic dispensary at the place of living. He was observed there, and on the base of penis, as you can see on one of the pictures, he had a reddening. No diagnosis was set to him, at least according to his words. However, these rashes were treated by liquid nitrogen for some reason. That is, basically the skin was burned by liquid nitrogen. As a result of that, the rashes localizing in the beginning were unhappy with this, and they spread to the penis itself, and from base of penis they went to areas of body of penis and foreskin. This made him worried, and as he was afraid to infect his wife who was at home and who he was going to meet soon, he came for examination. He was examined from the surface of rashes and from inside the canal. Unfortunately, we didn't have a picture that was there in the beginning of this treatment by liquid nitrogen, done without analysis. It's not clear why the doctor made this decision, but these clearly were not condylomas acuminatas, because the following fresh rashes on body of penis were totally different from genital warts or condylomas acuminatas. So we first took analysis for sexually transmitted infections. They were negative, including human papillomavirus, for which sometimes liquid nitrogen can be used if rashes are superficial. Then analysis for immunoglobulin E, circulating immune complex, were taken, as well as other blood analysis, and as a result of them, there was an increased number of basophils. These are allergy cells, and a number of immunoglobulin E, which is 4.5 times more than normal. This indicates an allergic nature of such rashes. Later on, injections of sodium thiosulfate and calcium gluconate were done. The patient refused to have examination by allergologist due to financial impossibility of such examination. Also, antihistamine medications were used. Elidel medication was used as non-hormonal anti-inflammatory medication. As a result of that, these rashes completely resolved approximately in 4 or 5 days. The patient was quite happy about it, and it's not clear why he was treated by liquid nitrogen in dermatovenerologic dispensary, meaning that his skin was burned, the more so without any analysis, which were not quite decent actions of a doctor. So, if there are any suspicions for some infections, or if there are any rashes, it's still necessary to know at least a minimal set of analysis. In some cases, these may be scrapings for fungi, analysis for sexually transmitted infections, analysis for allergy, bacterial culture tests, etc., in order to find out the true nature of rashes, and not to just burn it by liquid nitrogen or other home means, the more so trying to find with these rashes somehow. If any rashes appear in the area of sexual organs and skin, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such rashes. We are waiting for you in our clinic.